Hello, I'm Dr. Mary L. Zozulin. I am an OBGYN at Westwood Women's Health, which is a division of Women's Health Connecticut. An inherited risk for cancer has been passed on from one generation to the other that can predetermine a person getting cancer. The BRCA gene, or BRCA, we call it sometimes, was actually found about 1995 after many DNA sequencing was done. So the BRCA gene, there's two types, 1 and 2. And they both cause increased risk of getting breast cancer, ovarian cancer, male breast cancer, prostate cancer, even some increases in pancreatic cancers. We found a whole lot about this gene and are still learning what mutations are out there and how they are affecting the people that inherit them. Typically, to know how or when to test someone for the abnormal genes is by looking through the family history. If there are breast cancers in your mom or dad's family that are in every generation, or they're in people that are young, before menopause, before age 50, or if there's ovarian cancer at all with these breast cancers, or an ovarian cancer in a person that's a first degree, like a mom or sister, then it becomes pretty likely, not 100%, because only 5% of cancers are ever genetic, caused by an inherited gene, that you may carry this gene. So if you have these things, these criteria, or you yourself have had early breast cancer, ovarian cancer, breast cancer in both breasts, again, that puts you at higher risk to having some sort of genetic predisposition. Today's gene testing has actually been simplified a lot. There is a kit. You just spit in a test tube, and we mail it to the company, and they run the DNA of the whole gene where we're concerned, or your whole DNA. So if a person tests positive for a deleterious gene, the next step is to figure out what that is and what cancers or illnesses that may increase your risk of. If you get one of these on your result, then we go through it with you, and then we decide what tests are next. So if you are at all concerned about your family having a genetic cancer, or that you have a lot of cancers, period, in your family, please don't hesitate to reach out to our office, Westwood Women's Health, or any of your providers in Women's Health Connecticut, and we would assist you and help you in this process of testing.